Hello everyone. Our today's topic is Parkinson's disease. Parkinson's disease is the second commonest neurodegenerative disease. It is estimated 1 million persons in the US, 5 million persons in the world. English doctor James Parkinson, who published the first detailed description in an essay on the shaking palsy in 1817. Risk factors of Parkinson's disease. Age, the most important risk factor. Positive family history. Male gender. Environmental exposure. Herbicide and pesticide exposure. Metals, manganese, iron, well water, farming, rural residents, wood pulp mills, and steel alloy industries. Life experiences, trauma, emotional stress, personality traits such as shyness and depressiveness. Parkinson's disease classification. Parkinson's disease, atypical Parkinsonism, secondary Parkinsonism. Genetic, atypical Parkinsonism. Multiple system atrophy. Secondary Parkinsonism, drug-induced. Sporadic, atypical Parkinsonism, cerebellar type. Secondary, infection. Dementia with Lewy bodies. Atypical Parkinson. Parkinson type MSA P. Secondary Parkinsonism, infection, vascular, normal pressure, hydrocephalus. Progressive supranuclear palsy in atypical Parkinsonism. Trauma, secondary Parkinsonism. Liver failure. Corticobasal ganglionic degeneration in atypical Parkinsonism. In secondary Parkinsonism, toxins, example carbon monoxide, manganese, MBTP, cyanide, hexane, methanol, carbon disulfide. In atypical Parkinsonism, frontotemporal dementia. Parkinson's disease pathophysiology. In Parkinson's disease, the striatum portion of the basal ganglia receives an inadequate amount of nigral cells, which impairs a person's ability to control movement. The basal ganglion's connection to the cortex and the thalamus also affects movements. Why are SNC cells especially vulnerable? Dopamine metabolism is considered to be critical for the preferential susceptibility of ventrolateral SNC cells to damage in Parkinson's disease. Dopamine metabolism produces highly reactive species that oxidize lipids and other compounds. Increase oxidative stress and impair mitochondrial function. L-tyrosine plus DHFA plus O2 plus Fe2 plus gives levodopa plus DHFA plus H2O plus Fe2. L-tyrosine plus Fe2 plus O2 gives L-tyrosine plus Fe3 plus O2 superoxide anion. Emphasis has recently been placed on a calcium-mediated toxicity in SNC neurons through Ca1.3 channels as compared to neurons of the ventral tegmental area, which uses sodium channels for Parkinsonism, etiology and pathogenesis. It has been proposed that most cases of Parkinson disease are due to a double hit involving an interaction between a gene mutation that induces susceptibility coupled with exposure to a toxic environmental factor. The most significant of these mechanisms appear to be protein misfolding and accumulation of mitochondrial dysfunction. Lewy body and Lewy neurites, which are composed of misfolded and aggregated proteins. Protein accumulation could result from either increased formation or impaired clearance of proteins. Parkinson disease, etiology and pathogenesis. Mutations in alpha-synuclein promote misfolding of the protein and formation of oligomers and aggregate through be involved in the cell death process. Wild-type alpha-synuclein gene can itself cause Parkinson disease, indicating that increased production of even the normal protein can cause Parkinson disease. Increased levels of unwanted proteins could also result from impaired clearance. Proteins are normally cleared by the ubiquitin proteasome system or autophagy lysosome pathway. These pathways are defective in patients with sporadic Parkinson's disease. Alpha-synuclein has an unknown function. It's an intrinsically disordered protein. Mutant alpha-synuclein forms fibrils. Monomer natively unfolded. Protofibril beta sheet rich oligomer. Fibril amyloid-like. Lewy body fibril. Mutations in Parkin, a ubiquitin ligase that attaches ubiquitin to misfolded proteins to promote their transport to the proteasome for degradation. UCH L1 which cleaves ubiquitin from misfolded proteins to permit their entry into the proteasome. Familial PD or familial Parkinson disease. Mitochondrial dysfunction has also been implicated in familial Parkinson disease. Several causative genes, Parkin, PINK1 and DJ1, either localized to mitochondria and or cause mitochondrial dysfunction in transgenic animals. Post-mortem studies have also shown a defect in complex 1 of the respiratory chain in the SNC of patients with sporadic Parkinson's. 6 different LRRK2 mutations have been linked to Parkinson's disease, with the GLIDE 2019 SER being the most commonest. The mechanism responsible for cell death with this mutation is not known, but is thought to involve altered kinase activity. Mutations in the gene associated with Gaucher's disease are also associated with an increased risk of idiopathic Parkinson's disease. Clinical features of Parkinson's disease: resting tremors, bradykinesia, generalized slowness of movements, muscle rigidity. Symptoms worsen as the disease progresses. Resting tremors. Most common first symptom. Most evident in one hand with the arm at rest. Usually unilateral, becomes bilateral, worsens with stress. Tremors. Usually first symptom occurs in the hands or arms, can occur in head, face, jaw and legs. Disappears with purposeful movement. Postural manifestations. Postural instability. Postural changes cause balance instability, rigidity and stooping posture. Patients also suffer from non-motor symptoms such as cognitive impairments, olfactory impairments, dysphagia, GI dysfunction, sleep disturbances, depression. Secondary Parkinsonism associated with drugs, stroke, tumor, infection, or exposure to toxins such as carbon monoxide or manganese. Drug-induced Parkinsonism. Side effects of some drugs, especially those that affect dopamine levels in the brain, can actually cause symptoms of Parkinsonism. Although tremors and postural instability may be less severe, this condition may be difficult to distinguish from Parkinson's disease. Medications that can cause the development of Parkinsonism include antipsychotics, metoclopramide, reserpine, tetrabenazine, some calcium channel blockers, stimulants such as cocaine. Usually, after stopping these medications, Parkinsonism gradually disappears. Vascular Parkinsonism. Multiple small strokes can cause Parkinsonism. Patients with the disorder are more likely to present with gait difficulty than tremor, and are more likely to have symptoms that are worse in the lower part of the body. Some will also report the abrupt onset of symptoms or give a history of stepwise deterioration. Symptoms get worse, then plateau for a period. Dopamine is tried to improve patients' mobility, although the results are not often as successful. Vascular Parkinsonism is static or very slowly progressive disease when compared to other Parkinson's. Parkinson plus syndrome. Atypical Parkinsonism refers to a group of neurodegenerative conditions that usually are associated with more widespread neurodegeneration that is found in Parkinson's disease. Often involvement of SNC and striatum and or palladium. As a group, they present with rigidity and bradykinesia, but typically have a slightly different clinical picture than Parkinson's disease, reflecting differences in underlying pathology. In the early stages, they may show some modest benefit from levodopa and can be distinguished and be difficult to distinguish from Parkinson's disease. Neuroimaging of the dopamine system is usually not helpful as several atypical Parkinsonism also have degeneration of dopamine neurons. Metabolic imaging of the basal ganglia / thalamus network may be helpful, reflecting a pattern of decreased activity in the GPI with increased activity in the thalamus, the reverse of what is seen in Parkinson's disease. Types of atypical Parkinson's disease: progressive supranuclear palsy, corticobasal degeneration, multiple system atrophy. Neuroprotective effect: tobacco. It also contains the monoamine oxidase inhibitors harmon and norharmon. These beta-carboline compounds significantly decrease MAO activity in smokers. It is thought that the powerful interaction between the MAOIs and the nicotine is responsible for the most of the addictive properties of tobacco smoking. Breakdown of monoaminergic neurotransmitters. The addition of 5 minor tobacco alkaloids increases nicotine-induced hyperactivity, sensitization, and intravenous self-administration in rats.